Welcome to this session of AIJC 2020. Just some quick housekeeping before we start. There is translation in this session, so choose your language. Go to the global icon on the bottom of your Zoom screen and click on English or French and mute the main channel so you only get one sound channel. You will see Roy Blumenthal on the screen. He is our resident caricaturist and sketchnoter working live during the session, and you'll see his work from time to time, or certainly at the end of the session. Please use the Q&A function for your questions or comments, and the facilitator will pick them up from there. Have a great session.
Good afternoon, everybody. My name is Sponsor Bilani, and I will be your facilitator for this session. Today, we're going to be discussing COVID-19 as it has upended our lives, but as a more specific topic that we'll be discussing is COVID-19 and corruption. Across South Africa and across the continent, we have heard of seeing the headlines of corruption finding its way even into COVID-19. You would expect a global pandemic to be the one time where we don't see corruption, but that has not been the case. And to discuss this topic with me, I have two esteemed guests who have done their own investigations into the corruption during the pandemic. And to start off with, we have Aderemi Ojekunle, who is an investigative journalist from DataFind, and we also have Peter Louis Mayberg from South Africa, who works at the Daily Maverick. I think before we even start, it would be very important to first mention, or rather start by hearing the journalist stories on how their nose even sniffed in the direction to see that there was some kind of corruption. Aderemi, do you want to kick us off in telling us how you saw some red flags in the stories that you covered and how you began the investigation, particularly the ones that you covered at DataFind?
Yeah, thank you very much, Francois. Good afternoon, my colleagues all over the continent. My name is Aderemi Ojekunle. I work for DataFind here in Nigeria, and DataFind is an open data platform. We do a lot of things as regards data journalism, and still a growing platform, and we hope we'll be able to do our bit in the cost of investigative journalism in Africa. So I have a slide. I don't know if you permit me to share quickly. Okay, so just about the question that you asked, what really prompted us to see some snips into COVID corruption in Nigeria, and that will take me to my first slide, where Nigeria first recorded its coronavirus case in Lagos, the populous city. So in February, the health authority confirmed the COVID-19 case in Lagos, and from that, a lot of financial contributions started popping in here and there from the private sectors, from individuals, international bodies, and all that. And the government decided that, okay, we need to quickly contain this virus, just as it's been done all over the world. And so far, how much was raised? A lot of money was raised between February and now. So how much was raised to fight COVID-19 in Nigeria? So between April and July, the Accountant General's office said they've been able to raise $95 million. That's about 36.3 billion naira in Nigeria. And within that period as well, they've spent about 80 million naira. That's roughly 85%, 90% of the whole fund that they generated. So on what? So the question now comes, on what? What did you spend this money on? What did you buy? What are the details about this fund? We really need to know. And so that was what raised our curiosity about where is this COVID-19 fund going into? How is government be spending it? Not minding the fact that we live in a society where transparency is second to none. So people just do things the way they want, the way they like, and all that. So we decided to, and being data organization is a data organization, so we decided to check the data, check the spendings, and find out what is our government using this money to buy. What are they doing with this money? So and that so that prompted the story. So I think I've done about two investigative reports on COVID-19 funding funding and the spending in Nigeria. And currently, I think I'm also working on another one that has to do, which is still going to be a huge one. It has to do with just a particular federal ministry that has spent a lot of money, and people are looking at where is this money going into. So the first story was about awarding contracts to just anybody, unverified contractors within the period of COVID-19. Some persons quickly to establish a certain company, and so as to get contract from government, so as to get part in this, to share in this fund. So we realize so we, in the course of our investigation, we had to like download a huge data from the government portal. This portal explains how I'll talk about the portal in the course of this presentation. So let me quickly do this. So this portal explains how government spend this money, where this money is coming from, and what did they use it to buy. So we, in the course of our investigation, so we found out that $90,000 was spent on face masks by just a single agency. I think that was about maybe 5,000 face masks just to distribute within their offices. They spent about $40,000 for liquid soap, 4.4 million naira mismanaged by 5 different agencies, and that's the story there. So the other story is about awarding huge funds to unverified contractors that are not registered with government, contractors that are that have not even registered their company. Yeah, I don't know if I should call them contractor here, but it's just what it is. So they call themselves contractors, so they get a huge money from the government to buy different kind of things. And you also notice that you see an engineering firm bidding or probably got a contract to buy face masks, a contract to supply hand sanitizer, contract to supply liquid soap, and you look at the correlation. You said you are an engineering firm. Why are you buying hand sanitizer? Why are you buying liquid soap? There are other contractors that are registered with the federal government that are verified, and these people didn't get these contracts. This is their area of specialization. This is what they've been doing for years. Why should a company just wake up within 5 minutes, 10 minutes and decided that wants to get COVID-19 funds, wants to get contractor, wants to get procurement contract with the federal government, and you just awarded contract like that to these people? So these are some of the questions that critical questions that we ask these agencies. Why are you doing this? Why are you spending this money? Why are you mismanaging COVID-19 funds? So how we uncover this? So which still points to what your question is all about. So we interrogate open data from the MDAs, we verify those expenses, we verify the contractors, sort and clean this data. I have links. I have links, and I have tips that I will share with colleagues that are in this room with us this afternoon. So we ask critical questions about different red flags that that we detect in the course of investigation. We ask ex practitioners, public officials, even the contractors themselves. Why did you get this contract from government? Why did government award this contract? You are not registered. This is government document. This is official document. Why did you get this contract? So a lot of things, even the MDA, the federal bureau agencies that awarded those contracts, that even inflate some of these contracts. Just imagine a particular MDA buying nose mask or hand sanitizer that worth less than $50 and budgeted almost $500 for one. So it's huge. It's very alarming, and that is why we have to point the attention of the international community to this particular story and say this is fraud going on in the wake of an emergency situation, in the wake of when a lot of people are dying from COVID-19. People had to access medical facilities that are not even in existence. People had to donate from their sweat. Even an individual, while we were checking those documents, we saw an individual, we saw Nigerian citizens donating as low as $1, donating as low as $2 to support government in containing these viruses, in containing this virus. And at the same time, people that you are supporting to contain this virus are the one they are now mismanaging this little fund that you have. Despite that, Nigeria is regarded as one of the um, poverty capital in the world. So where is this fund going into? How can a citizen that is still managing to eat 3 square meal in a day donate $1 to this cause? And at the end of the day, you are mismanaging this fund. So quickly, so I have tips. I think the organizer will share this across to participants or probably drop them in the chat box. So these are some of the things that we did, and if you check at the top edge of this screen, so you see COVID-19 daily treasury statement. So this is where we have huge data about what is coming into the government purse every month. I think they started in April, so every month people donate certain amount of money to the COVID-19 treasury account. So they pay this money into it, and government had set aside a particular portal where citizens can go and check who is donating and what we are using this money to do. So I think the portal is part of the transparency policy of government, so that they will be able to get probably loan from the international community, because I think that's part of the criteria for you to be able to get loan. So the Nigerian open contracting portal is one huge one that has a lot of data as regards COVID-19 spending in Nigeria. If you want to know how much a particular MDA spend on COVID-19, how much they bought this, how much and even the portal is not 100%, it's not 100% like accurate. And when I say accurate, in terms of payment description. So you see MDAs manipulating the system as well. Instead of them to say, okay, we bought 5 hand sanitizer for $5. So they will just say hand sanitizer $5. So it will be difficult for you to understand how many sanitizer did these people actually bought with these $5. And when you tend to ask questions, they tend to push you here and there in the course of your interview, so that that story will definitely be delayed, or probably you get frustrated along the line. So another portal is the Bureau of Public Procurement. So the Bureau of Public Procurement owns the Mococo portal, so where you have a lot of gist about government spendings, government expenditure, government. And so the next one is contractors verification portal. So this is where you verify who are those getting this contract. So this is where you know whether this contractor is listed as part of contractor that could be able to get contract from the government or not. So this is where you raise critical question either from the federal bureau agencies, or you ask the contractor themselves. But you are not listed as part of government contractors. Why did you get this contract? Then you can ask the other side, why did you give this contract out to this contractor? Because it's not part of verified contractor, it's not part of the enlisted contractors to get contract from the government. And for you to be able to get contract from the government in Nigeria, you have to meet certain criteria. criteria which are even beneficiary to your workers and beneficiary to the society, because a lot of revenue shortfalls is happening in Nigeria. Government needs to shove to see how they can maximize tax, how they can maximize profits so that they will not be able to borrow, there will be less borrowing from the international community. So these contractors, if you didn't meet some certain criteria, you cannot get contracts from the government. So we have the open treasury portal as well. The portal is just there to give, is by the accountant general of the federation. It just gives you lowdown of what and what government is paying for every blessed day. So on each particular day, government pays these also people a lot of money. So you tend to know that government has awarded this contract. How do I follow that this contract has been met? This contract is still undergoing, or probably in your street or in your neighborhood, you notice government that government plans to renovate the road, and you want to check if actually they've awarded the contract to someone, or they paid that particular contractor a certain amount of money. So that is the portal where you check and you try to follow up with whatever story you are writing on. Then we have our own personal data, which is the data fight open portal. Though the open portal is still, we are trying to upload a lot of things on it, but the portal will definitely be a huge one that people can come in and check a lot of things, a lot of clean data. So that is the essence of the portal in the whole sense of it, just to make clean data available to journalists so that when they check, instead of them going to the NOPOPO, the Bureau of Public Procurement portal, they'll be able to see it on the Data Fight Open portal in a clean format, just for you to read and understand what the data is saying and move from there. So tell your government to keep receipts of COVID-19 spending. Thank you so much.
Thank you so much, Aderemi. I mean, some of the points that you make, it's some, as I go, move on to Peter just now, you know, you raise some of the issues that we in South Africa ourselves, we saw being primarily the issue when it came to COVID corruption and issues around overpricing of the personal protective equipment. For example, in one of your investigations, you gave an example that a 500 milliliter bottle of hand sanitizer was being sold for 6,500 Nigerian nairas. That's an equivalent of about 285 rands, South African rands. And this is kind of some of the thematic areas or some of the areas in which we saw the corruption of COVID funds manifesting in South Africa. When in September, when the Auditor General here in South Africa released the first special report on the management of funds for government's COVID-19 response, one of the things that the Auditor General, Kimi Makwetu, said was that there were clear signs of overpricing, unfair processes, and potential fraud, as well as discrepancies in our supply chain management. And as you were speaking about what is happening in Nigeria in the agencies, this is more or less the same thing. And this is when I want to just bring you in the conversation, Peter Luis, to tell us about the three investigations that you did, but particularly why or how you came about, in the same way that Aderemi has just explained, that he found, you know, he started sniffing around the procurement processes. And this seems to be how a lot of the corruption is taking place when it comes to how COVID-19 relief funds are used. How did you come about your stories and doing the investigation into how the funds were being used in different in the different departments and provinces? Peter?
Question, Pancho. Yeah, so I think in the South African context, it's quite sad to say that I think, you know, myself and my colleagues in the industry, in the investigative journalism sort of fraternity, we didn't really, you know, only later on, you know, go to look for certain red flags because it came about. We actually actively anticipated that the COVID expenditure would be accompanied by large-scale malfeasance and looting. You know, that's purely for the reason that years of looking at government expenditure has always shown, unfortunately, that any large-scale public procurement, it does tend to be accompanied by a whole lot of dubious, you know, financial dealings. So it seems that, you know, you mentioned quite rightly in your introduction there that, you know, the South African government, and I'm sure the Nigerian government, made similar commitments, but we were very prominently told and promised essentially that because of the special nature of this development, this really concerning development around a pandemic, a novel pandemic breaking out, we wouldn't have to also deal with the issue of large-scale corruption accompanying the expenditure for the pandemic specifically. Those promises came from President Cyril Ramaphosa's office all the way through to our health minister, Dr. Zweli Mkhize's office. So, in those early days, around March especially, we were told that, X amount of money would be utilized to go and procure vital items, like the personal protective equipment, for instance, the ramping up of hospital capacity, field hospitals, and so on. And we were given these kind of figures that provisional figures that government intended utilizing for these items. And unfortunately, as soon as those figures are thrown on the table, an investigative journalist immediately kind of sits upright and says, well, there's going to be a very big amount of money flushed out of the public fiscus, and that certainly will attract opportunistic business people who, we quite sad in our realize are totally occasion agnostic, in the sense that, there's no sense of occasion among these, business people who prey on the public fiscus. They don't care if it's a train contract or a port contract or contracts for a public health emergency. Unfortunately, there is this fraternity of business people out there who view public expenditure as an opportunity to stuff their pockets. And, the second big red flag, of course, is where some of the earlier examples I mentioned, I've worked on rail infrastructure contracts, for instance, that normally would occur in what we now view as normal times. So there would be more time available for a procurement process that is kind of aligned with one's country's constitution or the laws and regulations that dictate how public money should be spent. Now, this time around, of course, because of the nature of the pandemic and the urgency for some of the items that the government had to procure and some of the services, of course, some of those procurement processes had to be sped up or completely aborted. So, where a provincial health department, Gauteng's, for instance, in the past would issue a tender for 1 million FFP2 or N95 respirator masks, for instance, and run quite a time-consuming month-long tender process, invite open bids. We now know, obviously, because government relied on emergency procurement measures, that was really sped up, and the normal tender procedures were kind of cast aside. So that now, looking back at those developments, it does seem to have opened the gates for all manner of very opportunistic companies, especially in our research looking at the medical goods and PPE field specifically. There really seems to have been a lot of contractors who, in fact, in some cases, the majority of the suppliers, who really are not equipped at all, not licensed, not mandated, don't have the standing or the background in the medical goods industry, which is a regulated industry, to supply these goods and services. And instead we saw these kind of fly-by-night entities, IT firms and so on, construction companies, engineering firms, kind of ditching their normal field of business or their area of business, and then kind of almost overnight turning themselves into suppliers of medical goods. And that, in our experience also, I'll walk through some of our investigations just now, but kind of tying into what other Remy said, unfortunately in South Africa too, the corruption and malfeasance, it always seems to go hand in hand with kind of hyperinflation of prices. So I think that there was a kind of a normal, almost if I can put it like that, inflation of these kind of goods and services because of global shortages. That one can understand to an extent, but I think as we've successfully shown, the inflation for some of these products went well beyond the kind of normal industry price hikes that came about because of global shortages. That was really kind of one of the more troubling aspects of it. So if I can just share my screen with you guys quickly, I'll click in here. You can let me know if I am sharing.
Yes, we can see it.
Great. So I would broadly say, my investigations for Daily Maverick kind of stood on two pillars. We initially started looking at, I think it was more an angle of politically exposed people, the classic PEP situation where individuals who traditionally are just very closely aligned to our ruling party or governing party or government, who've always kind of been front in line when it comes to government contracts. So we picked up on that quite early on. And if my timeline is correct, I think this was our first kind of major reporting project on COVID-related goods and services. So there was quite a hefty contract for e-learning suite for tablets and related devices that the Eastern Cape Department of Education wanted to roll out. Obviously their kind of reasoning was that because of the lockdown and at that juncture schools were closed, kids were going to school, they had this kind of very sort of laudable or lofty ideal to ensure that kids, kept on receiving an education, which is obviously something all South Africans would have wanted to see. And there were kind of these kind of breadcrumbs coming through early on. The provincial government was never really very clear on who actually got this contract. So we started looking at that very closely, and we then found that, one of South Africa's kind of known politically linked business persons, they had clinched this quite substantial contract to deliver on this project. And it later turned out, so I think our initial reporting included this 160 million rand figure, but we later established that it was actually much higher. There was a follow-up report. If I could just go back quickly. And we were actually able to peg that figure at around 500 million rand, which the Eastern Cape government and specifically the Education Department was willing to part with and to pay this company for these e-learning tablets and the accompanying technology. And, analyzing, so we actually got some records and documents that kind of went to the heart of how this contract was set up. So we could actually see how to what extent they inflated their goods and services to come up with a figure that they were going to charge the Eastern Cape Department of Education. Now, these are kind of just some of the items, the line items that we identified and decided to visualize in these kind of nice graphics that just kind of takes the reader into the inflation. So there you can see the kind of 407, more than 400% markups on some of the items that they were going to supply to the province to make sure this e-learning service was rolled out. So that was kind of the first major one. And I think, for us personally, for me personally, that was really it kind of triggered a bit of a snowball effect. I think it's always great to receive feedback from one's stories, and that certainly happened. So we just kind of increasingly got more and more information on COVID expenditure in general, not necessarily only in the kind of the e-learning domain or in the Eastern Cape or whatever the case might be. So we next jumped I did to the Free State, Eastern Province's neighbor up north. And there, once again, a kind of classic example where some of our senior political figures' families kind of routinely tie into or benefit from these expenditure drives. So this is the former premier in the province, quite a prominent figure in our political scene. He's now the Secretary General of our governing party, Mr. Aismagashule. His sons also, got their hands on some of the COVID-19 expenditure in the Free State, delivering, as we also later found out, products that they actually legally barred from supplying to government because it is regulated medical goods. I think in their instance, one of them supplied the theater gowns or surgical gowns that the hospitals needed for combating COVID-19. So then I think at that juncture, there was increasingly more expenditure-specific data being released and becoming available. So I kind of abandoned my focus on the PEP angle specifically, and I jumped over to raw data. I really thought that, this is an expenditure story, and it's really always, of course, if it's captured in raw data, and we have access to that, I think it really becomes prudent to take the time to sit down with that data and really start cleaning it up and building your spreadsheets and to see what's going on with the expenditure. So that was a rather time-consuming exercise. But our first break in this regard was we broke down the Gauteng Health Department specifically and their expenditure, specifically because it's our biggest province in terms of population, and it also was our biggest spending province for personal protective equipment specifically. So this is the Gauteng Health Department. And yeah, once again, sort of corruption, malfeasance, mismanagement, it does so frequently, seem to come hand in hand with hyperinflation of goods and services procured by taxpayers or, on behalf of taxpayers. So what I did for this one, the Gauteng health data, unlike some of the other provinces, was very conveniently very detailed. At least the early batch of data that they released. So whereas some of the other provinces were kind of quite broad in what they bought, what they procured from some of these suppliers. For instance, I think it was maybe KZN or Mpumalanga. The earlier sort of disclosure reports would kind of broadly say that we bought PPE from supplier X or whatever. Whereas Gauteng's data, along with, actually as I recall now, along with some records that I'd obtained from a source before it was publicly made available. In any case, that data went into a lot of detail showing from what contractors exactly that they buy a digital thermometer, from what contractor did they buy gloves, surgical gloves, or the surgical gowns, the masks, the respirators, hand sanitizer, all of those products. So I kind of deconstructed or broke apart that data set and built it into my own spreadsheets. And that really allowed me to, it was a bit of a consumer study, really. What I did was I looked at what the Gauteng Department of Health had paid all these contractors for their specific goods and services. And then I went about, after having concluded that, and I built these kind of baseline prices that during that time frame, government should have paid, a responsible government that is looking after every rand and cent of the taxpayer money they spent. And I kind of did that, by incorporating, of course, it was important to keep in mind that during March, April, May, especially those early months, as I'd mentioned earlier, there were these global shortages. So that did push up some of these items. For instance, if I have to get into real specifics, N95 masks globally ran out. That is well documented. Everybody struggled with that. But nevertheless, there were these items that were still on offer from other suppliers. So I went on a bit of a fact-finding exercise by contacting quite a broad array of importers, manufacturers, dealers in these products. And I built an average price for each of these items I looked at that a whole bunch of other suppliers could have supplied it for at that juncture. So now you've kind of got the cumulative price for what the Gauteng Department of Health paid for all these items. And you've got a more sort of market realistic price for what really, they should have been spending. And the discrepancies in a lot of the cases were just plain shocking, So think Gauteng, these are the issue, I think 10 products we looked at specifically, yeah, 10, including some of the different kind of masks, surgical gowns, visors, the thermometers, hand sanitizers, and biohazard bags. And for that round of expenditure, so Gauteng, you know, they ended up paying 1.28 billion rand for all of this to, I think it was about 80 odd suppliers. Whereas the market price, you know, what they should have really have paid more or less would have been less than 800 million rand. You know, so they already, you know, there's a 500 million rand gap that taxpayers seem to have been done in by. And, you know, then you can kind of draw the over expenditure all the way through to kind of connected individuals. You know, once again, individuals, companies who don't normally trade in personal protective equipment, but seemingly kind of just got their foot in the door because they are kind of politically connected. Yeah, this particular piece, it was also important for us to kind of visualize all the kind of the line items that have the largest or the most sort of compelling examples of price hikes, like the surgical gowns. You know, it's just really, in each instance, you know, taxpayers' money kind of going to waste and going to contractors who really inflated their prices to a gross extent. So that was data piece number one. Then for the second data exercise, somewhat even more time consuming, I wanted to step out of the provincial focus. So I'd looked at the Eastern Cape's kind of tablets, for instance, and I was in the Free State with Ace Magashula's sons and Gauteng and their sort of inflated prices. But I now wanted to bring together a more coherent countrywide picture in terms of our COVID expenditure data. And this by now was thankfully possible because, as in Nigeria's case, the South African government and the Treasury specifically, they were starting to, let me just quickly jump back there. They were starting to publish for public consumption some of the expenditure reports and some of the expenditure records. So, kind of broadly what the landing page looks like. And this would allow sort of journalists to kind of break down the expenditure per province. And in some of the cases where the individual provinces did a bit more homework and were a bit more accommodating for the journalists who would have to work with the data, they actually broke it down per department too, which was quite helpful. So all your health departments and all of that. So I decided to stay with the health departments. You know, I think this is a health crisis. So it would never have come really as a surprise that the individual health departments, our 9 provinces health departments, they were always going to be responsible for the largest chunk of the expenditure. That kind of, it did turn out to be the case. There was also, of course, vital infrastructure expenditure, you know, departments like the Department of Public Works in all the provinces, they did spend quite a lot of money. But when we kind of started breaking it down, it was quite evident that the health departments in each instance, they were responsible for the largest chunk, by far and large, of South Africa's COVID-19 procurement. So just a little example quickly of what that would look like more or less. So if you go into some of the provinces had very sort of nicely packaged expenditure disclosure reports. So this is KwaZulu-Natal's, for instance. If you get past some of the introductions, it kind of takes you into the kind of the raw data. So you can now really get down to what the individual departments in KZN, for instance, had spent during that time frame. And so it goes for all the provinces. So they wouldn't all be as nicely packaged. So this is Limpopo government, Limpopo provincial government. And here it requires a little bit more data cleansing. A lot of it, unfortunately, quite manual, because the web crawlers don't seem to work so well on because of the way in which a lot of this data was processed. So I had to individually pick out the expenditure for the health departments here. It was very mixed up, unfortunately. But alas, we did get to the point where we cleaned it up. And this was the result. So we published quite recently our kind of latest big piece on South Africa's PPE expenditure. So I focused on the health departments and specifically what they were spending their money on in terms of what is controlled medical goods. So South Africa we've got a regulatory body, the South African Health Products Regulatory Authority, or SAHPRA, and they police and monitor, South Africa's trade in things like masks, surgical masks, and so on. Items that are used in clinical settings in hospitals, which really shouldn't be sold by any random car mechanic or IT firm or whatever, which really was the case in our instance. So we added up the expenditure by looking at unlicensed vendors. So each province had a list of companies that they were procuring from. Some, as I mentioned, more detailed than others, but I could eventually, where the detail was lacking, with a bit of manual legwork, I could find out where the Eastern Cape, for instance, they initially didn't detail where or from what contractor they bought their surgical masks or respirators or whatever, but we eventually got hold of a lot of that data too. And now we could actually see that this isn't South Africa's total expenditure in response to COVID-19. This map reflects the 9 health departments, each provincial health department's expenditure on medical goods from unlicensed suppliers. So these are companies that don't have the necessary licensing from SAHPRA. In other words, they are unlawfully selling PPE and other medical goods to the health departments. And it really it was a very interesting exercise. And once again, I think with data, it really is the international best practice now to always visualize that as nicely as possible, because I think our readers can get lost in big figures and data and an overwhelming amount of text. So we broke it down, and it really shows you the shocking extent to which large amounts of money was channeled to unlicensed companies as opposed to licensed companies. In some instances, it just got completely by far outnumbers the expenditure from companies who had the required licenses. I mean, you could look at Limpopo, for instance. They bought these products, the masks, the respirators, the surgical gloves, from 64 suppliers, and only 2 of them, the green ones, were licensed to sell them. I think we broke it down. It might be a bit clearer. There's Gauteng, for instance, really just shows you 98% of their expenditure went to unlicensed suppliers, which really is shocking if you consider that it's not rail equipment. This is a life and death matter. In this round of contracting, they were buying things that healthcare workers, frontline healthcare workers, were using in hospitals to protect themselves and their patients. And it seems that our provinces, they went out and discarded that consideration and just bought from every Tom, Dick, and Harry who came to them with a respirator mask or whatever else they were buying. And it was province-wide. We've got one for our international audience, one province that always, boasts about its expenditure records and its ability to be sort of less corrupt than the rest of our provinces. But, in this instance, the Western Cape too, they ended up buying quite significant amounts of these goods from unlicensed suppliers. So it was actually specifically, it was respirator masks, which they bought from a solar power company. And the other one is a mechanic, an auto body shop, who sold goods that went to healthcare workers in hospitals. And then we also tie that into, there's already kind of anecdotal evidence coming through that, people may have been infected with COVID-19 because of ill-fitting or just like unregulated personal protective equipment that the healthcare workers ended up having to use. So yeah, that is a brief account of the reporting I've done so far. I can kind of say that, it really is kind of just talking about the exercise of reporting on this. Just kind of, it once again shows us how important access to information really is. For journalists like myself and, my colleague there in Nigeria, this really essentially is information that should never be, kept under wraps by a government. So I think it's quite encouraging that this time around the data did seem to come pretty quickly. Some of the provinces' data was lacking in terms of detail, but thankfully, while the corruption and the mismanagement seems to have been absolutely rife and shocking, the transparency was a little bit better this time around than in previous years, in the South African context at least. Our Treasury and some of the individual provinces did disclose these figures quite timeously. So there's a lot to work with, and yeah, it's definitely not the end of the road for us in terms of going through all this data. There's definitely reams of unmined and unprocessed data that I'll also continue to look at.
Thank you so much, Peter, for that. Listening to both you and Aderemi, they're like very similar kind of situations of governments trying to hide the data, as you've just said, and having to almost badger them for the information. We have a question from Tony Tendai, and he says he wants to know if you came across any stories of governments linking up to defraud funds like he has seen or witnessed in Zimbabwe. So I think what he's talking about is in countries and governments actually colluding to collaborate in this COVID corruption. Is this something that you've seen, or is this something that could possibly be something yourself and maybe Aderemi and other investigative journalists across the continent could contribute and collaborate on? So I can start with you, Peter, and then I'll go to Aderemi to see, is this something that is on your radar, or something that you've seen of looking at maybe what's this continental kind of corruption, and if there's any links? Because clearly if the scale can happen nationally, we can think about it happening outside of the country and with collusion from outside the country.
No, definitely. Look, I think there's a lot of scope for that. Definitely is a lot of scope for cross-border collaboration, because, in those early months of the pandemic, especially, there was a lot of cross-border trade in some of these products that governments procured. So I would not be surprised if there was kind of continent-wide trade in some of these products by unlicensed, for instance, or, illicit sort of entities that were set up specifically for this. We've kind of seen how in the past, products would come into South Africa, for instance, from China, and it wouldn't necessarily always come directly from China, but kind of follow other routes. So I would love to get some more information in terms of what was really happening in the global trade of the masks, especially the N95 mask, for instance, the KN95 mask, and so on. If there was any kind of interesting cross-border or continent-wide dealings that we have to look at.
Thank you, Peter. And Aderemi, just to bring you in as we're about to wrap up, Peter was talking about how in his investigations, he saw about more than even 400% markup. And with your investigation, you saw similar kind of outrageous markups of some of the PPE and hand sanitizers and other products that were required to respond to the COVID-19 pandemic. And when you're looking at these figures, in your case, did you struggle or were there any threats to your safety? Because in many cases, sometimes when you investigate these things, you can see some kind of, there's personal liability that may come. Did you experience any intimidation or withholding of information from the Nigerian government or the agencies that you were investigating?
Yeah, thanks so much. I think threat is one of the things that is very, very, with us as journalists, we tend to get them every day. So we deal with it every day. So in my own case, in the course of my investigation, just as Peter has said, I didn't get threats in the form of threats. Let me use the word. I think, but I got a lot of things that has to do with drop this story and name your price. How much do you want for this story? To the extent that I got one of the agencies that had to tell me that, hey, bro, this this procurement happened and the prices were inflated. But I'm telling you this off camera. How much do you need? Do you want to come to our office in Abuja? We have a meeting, let's discuss this. Not let's meet in another city entirely. My DG, Director General, wants to speak with you. My Director General said you should drop this story. So a lot of issues like that, trying to bribe, trying to kill the story. Even at the verge of we publishing that story in our newsroom, they still have to come back that okay, you've published the story. We still want to kill that story. We want to do a press release that will counter that story, and we are ready to pay for it. And even when you tell them big price so as to scare them away of money just because you want to open some of the shady deals that they've done in a particular thing. So we for me, I fix a lot of things apart from I've not particularly on COVID.
Okay, I think we're losing
Hello?
Aderemi's connection. Hi, Aderemi, your connection is a bit weak. And
Yeah.
I think, thank you, but we did hear around that you were not necessarily threatened, but your story was, there were many ways in which government officials tried to kill your story. And with wrapping up, Peter, perhaps with a better connection, we can answer Isaac's question before we wrap up, when he's asking really about how did you deal with a situation where the government has denied access to procurement expenditure or companies supplying the COVID-19 items, yet keep on asking for supplementary budgets, and this is something that was particularly in your case, for a long time you were asking and you were publicly talking about how you're looking for this data, you were looking for these numbers and these figures and the suppliers, but for a long time government was not forthcoming with this information, and until there was a lot of public pressure when journalists went public around the fact that we were not being given access to this important information. So how did you go about that? Was coming up publicly the last resort for you?
Yeah, look, I think it is frequently. I think as an industry, we can definitely do ourselves a big favor by, in these kind of situations, standing together and collectively exerting pressure on government. So I think that did kind of come about to an extent. I think our government never really had a choice really to eventually release a lot of the data in any case, because our media outlets were always vocal about the fact that this was really, it's kind of the epitome of what is public interest information. And I think therefore government really never stood a chance in terms of trying to sweep some of the expenditure under the carpet. But what does become frustrating is, if we, once again, we start looking at the data, and we really need to sort of go into specifics. For instance, in a lot of these cases, if we want to compare prices, if we want to look at, who's the unlicensed vendors supplying things that they're not supposed to be supplying, then it becomes clear that the data quality is not, it's not on the same par with the different provinces. And that became really, really tricky, kind of getting additional information out of the Eastern Cape Department of Health, for instance. It really was a very frustrating exercise to push them. And then you start to make alternative plans. A Promotion of Access to Information Act application is useful, by application, but in this instance, we kind of had to get the information quicker than that. That's normally like a month-long process. So that's when you kind of like you manually start trying to cultivate some sources in those spheres of government and seeing if they're on those, because there's a lot of, we have to keep in mind, there are also a lot of good-natured, good-hearted civil servants out there who wants to see this information coming out. So I think that would be any journalist next kind of go-to, is to start manually getting this information from individual government officials who might be amenable to sharing the information off the record and in the background, of course.
Thank you so much, Peter. And as that is where we end things off today with our chat on COVID corruption and how some of the leading investigators on the continent blew the lid on the corruption that government was taking part in. And with that, we'll wrap up this session. My name is Bonsa Pilane. Thank you so much. Thank you especially so much to AIJC for having us, but especially to our esteemed guest, Peter Lewis Mayberg from the Daily Maverick, and Aderemi Ojekunle from Datafile in Nigeria. And with that, please join us for the training session that kicks off at 3:30 this afternoon. Thank you, ladies and gentlemen, for joining us for the session.